Welcome to Season 5 of She Ventures. I am your host, Doria Lavanino. She Ventures is a podcast about women and their work and life pivots. I believe in the power of storytelling. I also believe that if you change one woman's life, you start to change a family or a community. Our mission is to elevate the diverse stories of everyday women in their worth. One promise, no mansplaining ever. Sit back, listen, and hit subscribe. We'd love to hear from you. You can find us at sheventurespodcast.com. Today's She Ventures is about the leadership of a serial entrepreneur. This woman co-founded her first startup while earning her master's in biomedical engineering at MIT, named Smart Scheduling, an intelligent app that improves access to healthcare, appointments, and medical care. She started working on her PhD at MIT, but instead decided to pivot when she decided to apply for the Presidential Innovation Fellow. And this is where she led the design, research, and implementation of Veterans Affairs' $10.5 million innovative network. And this was to empower, and still is, to empower Veterans Affairs employees to see and solve problems on the ground by using one of the 33 medical centers countrywide. And today, in addition to being a parent, showing up on the podcast, 39 weeks pregnant, she is the co-founder of SimpliFed, a company that supports new mothers in feeding their newborns, a process that may sound simple, but it is anything but. But it doesn't have to be that way, and she's going to tell us why. Andrea Ippolito, welcome to She Ventures.
Thanks so much for having me. Excited to be here.
I always love having, a fellow Italian, obviously, but I was really interested in your journey. You have 2 master's degrees. You had your first startup and exit in a hackathon, and you eventually sold it to Athena Health. So talk to us a little bit about the need for a smart scheduling tool and how you were able to identify it.
I was very lucky to be part of a founding team that had great clinical depth. And how smart scheduling got started is a physician, Dr. Gabby Belfort, whose wife also happened to be a physician. He pitched the problem at Hacking Medicine Hackathon that 1 in 5 patients no-show. And that's a huge issue in healthcare because it impacts access to care, also impacts revenue. And with razor-thin profit margins in healthcare, it's oh so important that you can improve access to care, but also keep healthcare systems afloat. And so another physician informaticist came up to him and said, you can use these tools called machine learning algorithms to predict who's likely to no-show. And that might include, the type of appointment or the time of day, age. One thing that's probably not surprising is that males in their 20s are more likely to no-show, and especially if they're for follow-up appointments, right? In general,
that's interesting.
Yeah, you think after a procedure, especially if you think you're feeling better, you're like, I don't need to go to this appointment. And we also know that often folks no-show to appointments due to transportation issues separately. And so with smart scheduling, we predicted who was likely to no-show. And after several years, we were eventually acquired by Athena Health. And that was led by Chris Moses, who was the CEO and just an incredible human being and leader in healthcare technology.
That is an exciting ride. And your interest in healthcare from the get-go, like how you married engineering and healthcare, seemed to always be an interest. Was that true all your life?
I am incredibly lucky that I am the daughter of 2 engineers. So my dad is a quality engineer and my mom is an electrical engineer. They're both very much retired now, but my parents both started off their career in spacesuit design. In particular, my mom was part of the team that helped design how female shuttle astronauts go to the bathroom in space. So if you think about that, that's always been a part of my upbringing. And I was very lucky to have 2 engineering parents. I always was fascinated by healthcare. And so went into biomedical engineering at an undergrad and master's. And I got really into tissue engineering right out of school and cell biology and cell engineering. I worked in medical devices and looked at the interface of our devices with the surrounding cells. And while I love that, I was actually a pretty average, mediocre scientist.
I doubt that, but okay.
I liked it, but it wasn't what was keeping me up at night because I was infatuated by the systems surrounding devices. I was infatuated of you can have this amazing technology, but if it doesn't get adopted or if it doesn't get reimbursed or if it doesn't get integrated into workflows in healthcare settings. And I was just obsessed with, well, if we can figure out the systems surrounding healthcare technology, then we can better accelerate the pace of healthcare transformation to really tackle some of the large, medium, but also small challenges impacting healthcare that we desperately need. And so that's what really motivated me to go back to school to study engineering and management in healthcare. And that's when started tackling some, systems level issues and got introduced to telehealth, where my graduate research at MIT was as part of a group for the chairman of the Joint Chiefs of Staff in the military health system on how might we use telehealth to improve access to care for service members faced with post-traumatic stress. And
Okay.
yeah, this was back in 2010, before the heyday of telehealth. And so I had a front row seat into some of the early adopters and leaders of telehealth. And I took that with me for the rest of my career. And ultimately, that was a huge instrumental factor in founding SimpliFed.
Absolutely. And a couple of things that I hear from what you're saying is you're an engineer and a scientist, but what is important to you is not necessarily, while it interests you, what's done in the lab. You are interested more so in how can we get this to be practically applied to everyday life, in whether it's through legislation, process, whatever. That's the first thing I hear. And then the second thing I hear is I understand better how you got involved with the White House. And you led, really, right? My understanding is with this presidential fellow of 1 year, and then I think you worked a little bit longer, you became aware of how big this opportunity is, and you led the design and implementation of 33 VA innovator networks. And correct me if I'm wrong, I believe that that's the largest medical network in the country. Is that right?
Correct. Yeah, I was super lucky. I, applied on a whim for the Presidential Innovation Fellowship, which was based out of White House Office of Science and Tech Policy and General Service Administration. And I was super lucky that my appointment was at Department of Veterans Affairs, which is the largest healthcare system in the country. Not a lot of people realize that, and I'm very biased, but I think it has the best mission serving, our nation's veterans, their families, and caregivers. And this was back in 2014, where unfortunately there were some bad actors at the VA that were engaged in some activities that were hiring veterans on quote unquote secret wait lists. What was happening is there was a lot of pressure at VA to meet metrics. Unfortunately, when you have such a metric focused culture, but not actually looking at things from a systems perspective, that drove some pretty bad behaviors, and veterans were getting lost in healthcare. And so unfortunately, this became a crisis at VA, leadership transition over, and I was part of a team that actually was brought in by the new secretary as part of this fellowship to actually go across the country, listen to the needs of our customers, which are veterans, their families, and caregivers, which I always think is the very best way to start any job, is to go out and listen to the needs of your customers and stakeholders. And that work helped the VA launch this transformation effort that no doubt it's still ongoing because it's the largest healthcare system. It's very, very complex. One of the things we noticed along the way is that, and our Secretary Bob McDonnell used to always say, we have no hope of improving the veteran experience unless we improve the VA employee experience. And a lot of people don't know this, but 40% of VA employees are veterans themselves. So it's just an incredibly mission-driven culture. My role at the VA was starting this thing called the Innovators Network, which was all about empowering frontline employees with tools and investments to better improve the experience for veterans, to improve access to care, to design the new set of innovations that could get innovated and diffused. To your point, it was across 33 VA medical centers. And then we had a whole investment mechanism called Spark Seed Spread, where we invested in different tiers of funding and huge portfolios of efforts. But the goal was to take something that was working really well in, say, one VA and scale it to other VAs, because that's the best way they were going to be able to take advantage of their scale. And there is a Institute of Medicine report that shows that it takes 17 years or more for something, once it's been deemed by, say, medical literature or journals as best practice, it takes 17 years for it to get diffused. I mean, think about that. That is insane. And so a big part of our work, at the VA was how might we accelerate that diffusion of innovation?
I wanted to reflect back a couple of things. Firstly, the idea of having frontline workers be involved in solving for what they're experiencing, seeing, I think also is, quite frankly, a great retention tool, because I think one of the things that is very difficult for many people who work for others is they feel that they really are kind of like a cog in the wheel. And it sounds like you were bringing, in a sense, entrepreneurship to the front lines. And so that was my perception of what you said. My other part too to that is there a particular innovation that really struck you that you want to mention that was a result of this program?
Yeah, I mean, there's so many, but there was one that struck me because I got to see the innovator recently. Her name is Dr. April Ma. She's based out of the Atlanta VA, and she is an ophthalmologist. And she was noticing that veterans were traveling 2, 3, 4, 5 hours sometimes to come to the Atlanta VA, which was a major hub. And so she designed this teleophthalmology program. And again, this was back before the heyday of telehealth, and doing some pretty amazing screenings that were tackling some pretty large pain points for veterans, impacting their sight. Out of the Atlanta VA, she designed this program, and it had incredible outcomes. It improved access to care dramatically. It saw tremendous health outcomes. And now it's scaling across the US. Veterans who previously didn't have access to this type of care now do. There were other innovations surrounding how do we integrate veteran stories within their electronic medical record. Too often in healthcare, you're treated as a patient, which is what you technically are, but your healthcare is so tied to your life, and especially with veterans and their families. And so there was this other amazing project that was all about bringing veterans' stories into their medical records so that the providers and care teams could treat a veteran with whole health approaches. And there was just countless examples of that. And it was just a really exciting program to be a part of, and it's still around today. And that's something I'm really excited to share, because too often I think in the innovation space, a lot of things are like spun up, innovation initiatives die, but it's truly embedded as part of the VA care and the employee experience as well.
That is fantastic and a lot to be proud of. And one of the things that strikes me about you is you're modest and hardworking, but always a leader in pretty much everything that you've done. And that's remarkable. And I want to get to that a little bit later. At some point during all this that you've achieved, you also got married and you started to have children. You've been quoted as saying that the idea for SimpliFed was the result of you having trouble breastfeeding your first daughter. And I wondered, how did that experience scale from that to a company?
So after I left the VA, at the tail end of my time at VA, I was pregnant with my first daughter. We decided to move to Ithaca, New York. I joined the faculty at Cornell, had my first daughter, and saw how hard baby feeding was. I live in Ithaca, New York, which has the highest breastfeeding rates actually in the state of New York. Tremendous support. It's an incredible community here. And with all that being said, I had tremendous difficulties with breastfeeding and baby feeding. And I didn't know what to expect. I learned that it was so deeply connected, not just to my baby's health, but my physical and, importantly, mental health. As an entrepreneur and healthcare systems person, I learned that under the Affordable Care Act, health plans, commercial and Medicaid, are required under the ACA, under federal law, to cover breastfeeding support starting during pregnancy at no cost to families without any prior authorization.
What should that exactly look like? Because I had children 19 and 14 years ago or something like that. The only breastfeeding support, and I did end up breastfeeding, by the way, thank goodness, because I just really, it was very important to me. But it was hard. And this whole idea of, had people say this to me. My father said this to me, for example, rest in peace, but he was the one who had to breastfeed. He was like, well, mammals do it all the time in nature. Like, what's the big deal? And it is a big deal, like to get the baby to latch onto your breast properly and all of that. And so what should people be expecting? Because the only thing that I got after my C-section was a nurse who came to me and encouraged me to breastfeed and kind of showed me how to hold the baby and how it would latch on my daughter. But like after that, it was nothing. So how much should people be getting?
Under federal law, it is your right to start getting prenatal baby feeding education, starting during pregnancy and in the hospital and after baby is born for as long as you're breastfeeding and baby feeding in any capacity. You should be getting access to insurance covered support at no cost to you, whether you're on a commercial health plan or Medicaid health plan. And what that care experience should look like and what we have developed via SimpliFed is that we meet you where you're at during pregnancy, do a lot of listening to understand your goals for baby feeding. If you have no idea what to expect, we set expectations on what that looks like based on what your goals are and do education on what you'd like to accomplish based on your goals. And after baby's born, we continue to work with you in an ongoing virtual way. Because let's be real, and I'm pregnant, 39 weeks pregnant with my third daughter, so I can say this, adding another appointment is hard. It's hard to get the time away from work. It's hard to get transportation. Often you need care at weird hours, nights and weekends that don't fit a clinic schedule. Babies often don't sleep, as we all know. And so we provide access to ongoing virtual care surrounding everything from latching, positioning, undersupply, oversupply, pain, sleeping and feeding. But something really important about SimpliFed is no matter how you feed your baby, we think you deserve choices that work for you. And so a really important part of the care pathway with SimpliFed is that we improve access to baby feeding support covered by your health plan, whether you're breastfeeding, pumping, or formula feeding, or G2 feeding, or whatever that looks like to you. And most parents start off breastfeeding and then most transition to formula at some point, and that's okay. And we need to talk about it in a way that is inclusive so that folks don't feel judged, folks don't feel pressure, because it's not just about baby's health, it's about mom's physical and mental health. And whether you're breastfeeding, formula feeding, pumping, it is so deeply connected to mom's health. And mom is often the discarded wrapper in this maternal health care journey. And so we do a lot of listening and validating of your needs, but also we have a national network of evidence-based providers that you can trust, that we vetted and know this arena and are experts in it so that you get the most evidence-based but non-judgment along the way.
So you're giving people science and saying, here's what the science says, and decide which one works for you. Because I think that is very important, because I did breastfeed and it was very important to me to do so. But I do remember at that time, there was a lot of judgment around women who either chose not to or couldn't or decided after a week it just wasn't for them. And that really is not helpful. After having a baby, to then feel on top of it like, oh, I'm failing at this. I love that you're supporting, SimpliFed is supporting women. And as you said, meeting them where they're at.
Exactly. And having that lived experience, really helped me see this pain point. And, here I was living in a community that was incredibly supportive of baby feeding and had lots of access to support. And I still faced tremendous difficulties, felt incredibly broken and lost in the process. And when I spoke with folks across the country, I learned that I wasn't alone, but that in other areas, and in particular maternal health deserts, there was less access to care. And the key with SimpliFed is we see ourselves as the leader in the baby feeding category. What we do is, because we improve access to baby feeding care surrounding this big pain point, which we believe, barring any medical issues, which are unfortunately pervasive in the current state of maternal health in the US, barring any medical issues, we think the two biggest pain points folks have postpartum are feeding and sleeping. And we would argue the reason you're not sleeping is because of feeding. And because we have this very sticky longitudinal relationship with the families that we have the privilege to serve, we can actually move the needle on some of these other maternal health outcomes. Remind them to attend their 6-week postpartum visit, which only 60% of women are attending right now. Remind them to attend their well baby visit. We do postpartum depression screening. Our ER utilization rate is 2.6% compared to the national postpartum average of 7.6%. We suspect that's because we provide ongoing access to care. And so even though we are baby feeding and breastfeeding specialists, we see signs that we're also moving the needle with these broader maternal health outcomes along the way.
Do you have any idea, based on the women that you've served, how many of them have had some level of postpartum depression?
It's unfortunately postpartum depression and postpartum anxieties and perinatal mood disorders more broadly are just massively underdiagnosed. And similar to what I was saying is that mom is often discarded as the wrapper, and moms deserve more help and care. And there is even more research that unfortunately shows that a lot of the maternal deaths actually are happening in the 1 year postpartum. And unfortunately, many of those maternal deaths are due to perinatal mood disorders and suicides and not really being there for moms in their postpartum journey. And we see this, unfortunately, all the time, and especially because we are a telehealth service. We have national contracts with Aetna commercially. We have state Medicaid health plan contracts. We serve all military families across the U.S. via TRICARE. And this July, we're going to be serving women veterans in the eastern half of the U.S. with VA Optum health plan care. What we see is especially that a lot of families that aren't in a community or are in more rural areas or aren't able to attend their healthcare appointments due to transportation issues, they're left in isolation to figure things out by themselves. And so, unfortunately, it is sadly very pervasive. And a lot of what our providers do, of course, within their scope of practice, is do a lot of listening. And then because we're meeting parents where they're at, we can then refer them to the mental health professionals that are trained in this arena. But we're identifying folks that do feel isolated and making sure they get better access to the care that they deserve with mental health care.
Two questions there. The first is, I wondered if at some point you might consider creating a community for women who are in SimpliFed to support one another, those that are geographically isolated or isolated in any way. And then this is a related question to mental health care. I know that it's very difficult to, how shall I say this? For mental health care, to find a provider, it's very difficult to have it covered for a very long period of time. And you have very little say, quite frankly, in who you go to. So is that been your experience as well? Or are you working to make it a better experience as well?
So a couple things that SimpliFed does as part of our care experience. The first is that we do have an online community that we invite patients to join, or frankly, anyone that's part of our experience, whether that's our newsletter, et cetera, we invite them to join that online community because we know that folks are feeling isolated and need peers to turn to. Secondly, we partner with healthcare systems and also mental health provider networks to refer to them. Our providers are amazing. They're internationally board certified lactation consultants, many of which are nurses, nurse practitioners. They're baby feeding experts, whether you're breastfeeding, formula feeding, or pumping, and they're not mental health professionals. And so it's really important that we partner with mental health professional networks. We partner with all sorts of networks depending on where the parent lives, because we want to make sure that they're getting culturally competent and culturally congruent care. So let me just give you an example of that. We work a lot with the military population via TRICARE, and the military, while still not perfect, has come a long way in their mental health and behavioral health care. And so we will refer to resources within the military community, whether that's Military One Source or other telehealth, telemental health networks that are available to them. We partner with healthcare systems in certain regions, and we have tight closed loop referral protocols back for folks that need access to mental health care. We're a baby feeding company, but yet because we are improving access to care and finding and identifying folks that are in these isolated settings, and by the way, not just rural, like urban,
It could be New York
suburban,
City.
it could be New York City, exactly, and making sure that they have access to the care and services they need and deserve and are entitled to.
How is the formula shortage? How is that affecting women, and any thoughts you have in that regard?
So I think the formula shortage just increases the stress on parents. And unfortunately, it's a symptom of a larger systems level issue and just a complete discard of mom and baby health, right? Most parents both breastfeed and use formula at some point. And we are very supportive of however you want to feed your baby. The fact that in the US, we are facing a maternal health crisis, an infant formula shortage, which by the way is still ongoing in many areas. They still have the three biggest players that caused this issue and the oligopoly surrounding this, but yet there hasn't been any system level change and transformation to happen, despite that our most vulnerable, truly humans, citizens in this country were impacted by. And of course, that had incredible, unfortunate impacts on moms' mental health as well, increasing the stress. It just shows you that we need systems level change here. So what does that look like? We need to improve access to baby feeding support covered by health plans as required under the Affordable Care Act. And that's why SimpliFed is so excited to be part of the systems level. We need more entrants in baby formula. And we obviously need the FDA and FDA getting more resources to identifying issues such as the coronabacteria issue from last year. We need just an entire system redesign and actually integrating baby feeding into the perinatal care pathway. And that's starting with education during pregnancy, setting expectations on what baby feeding looks like, and then designing a plan that works for each parent. And so we see calls for the US is declining in population and all this thing, but yet we don't actually invest in supporting American families, in particular American women. This is just one of many examples of the system level changes need surrounding paid parental leave, universal childcare support, baby feeding resilient systems, insurance covered breastfeeding support, better access to formula from more stakeholders. So this is all part of the systems level change that's needed in the US.
If I am pregnant, I start working with SimpliFed. Will you work on behalf of me to deal with my insurance company? I ask that because I find it incredibly stressful. And particularly once I had a baby, that was like the last thing I wanted to do is fight with insurers.
Yes, and that is so important. Navigating health plans and insurance is so hard. So that is exactly what we do. You get a referral to us, say from your healthcare provider, or you can come directly to our website. Again, no what's called a prior authorization is needed. What that means is you don't need permission from your health plan, technically under federal law, to get access to the service. So folks come to us just via our website, go to simplifed.com. You can text us, fill out a secure form, or many healthcare providers start referring to us during pregnancy. We're part of many healthcare practices' 28-week order set. So many folks get that 28-week glucose test where you chug that sugar drink, not the most enjoyable experience.
I failed it both times, and then I ended up not being diabetic, but I had to do that super long test. Anyway,
I also failed it recently with my latest pregnancy. Yeah, it's quite the chug. So we're part of that 28-week order set that happens where we do that prenatal appointment. And the good news is that we work with the health plan so you don't have to, because we know you already have a lot going on when you're either pregnant or postpartum, and you don't have time to navigate that. And we think it should be frictionless and a thoughtful experience for you so you can focus on your health and your baby's health.
I love that. And I think the fact that you experienced it yourself is part of why you're so passionate about it. Entrepreneurship has its highs and lows. What have some of those been for you, and how have you navigated them?
When you are an entrepreneur, you are trying to redesign something. And I don't love the word disrupt in healthcare, because in healthcare, we need pathways that actually integrate with healthcare systems. Because when you disrupt something, while that sounds very sexy and exciting, it often benefits a select class of few. Whereas our goal with SimpliFed is to elevate this clinical specialty of baby feeding, integrate it into healthcare, which involves redesigning systems and workflows and getting buy-in and going up against entrenched systems. We're up to the task. We have a value within our team we say respect the bureaucracy. And that probably sounds very strange coming from an entrepreneur, but we believe that by respecting the bureaucracy of healthcare, it will allow us to better integrate within the system that will allow us to improve access to care for everyone, whether you're on private insurance, and in theory, you could pay for it out of pocket, but we don't want that. We want your health plan to cover it. Or you are on Medicaid, which, by the way, over 40% of all births in the US are on Medicaid. You need to really think about how to improve access to care. And we fight on behalf of the patients that we're lucky to serve to ensure that they have access to support, no matter how you feed your baby, whether that's breastfeeding, formula feeding, pumping. A lot of the journey as an entrepreneur, especially in healthcare, is fighting that bureaucracy, or working within that bureaucracy, I should say, so that you can improve access to care. And that's very much part of the highs and lows.
Yeah, to your point. I mean, I didn't know, and I'd like to think I know a lot about women's issues, and yet I really actually did not know until I researched you, SimpliFed, that it actually is a requirement that some health insurers maybe just choose not to pay attention to. And so that's a big deal. Likewise, how do you feel about, well, not how do you feel, what do you think about the Pump Act being passed? Do you think that it will be a game changer for women in the workplace?
The Pump Act, for those that haven't heard of it, is actually based on legislation that passed over a decade ago, which essentially gave parents the right to pump in the workplace. This is a classic example, unfortunately, of if policy is not written and designed well, it can leave people out. The original policy from over a decade ago left out 25% of women in the workplace. And so the Pump Act essentially righted that wrong. And what the Pump Act does is it says the following. One is, if you are in an employer with 50 or more employees, so here you go, there's still disparities just based on what I just said. But if you're in an employer with 50 or more employees, it is your right to get access to a place to pump that is not a bathroom that you can pump. And it also is your right to pump in the workplace and be compensated for that. So it is part of your workday being able to pump. It's not a lunch break. It is part of your workday. You are paid for that time, and it cannot be a bathroom stall. It needs to be a dedicated space where someone cannot barge in. Employers have to be in compliance with it. The other thing that people don't talk about enough with the Pump Act, that it's nuanced, but it's such an important thing, is in legislation, it identified pumping as a physiological right. And as someone who pumped, especially with my second kiddo, pumping is not just something you can push off, because you have to do it. And pumping and baby feeding and breastfeeding, milk will clog, cause infections. And as someone who's had mastitis, that is a very real healthcare issue, and is often one of the main reasons why women are presenting to the ER or getting readmitted. And it can result in the formation of abscesses, which can require surgery, and it is not good. And so when people talk about pumping in federal legislation as a physiological right, which it is, that is like a huge game changer, in my opinion, that we need to talk about more. And it recognizes the importance of that breastfeeding is women's health, and women's health is health.
Women's health is health. Yes, thank you. One of the things I've really noticed about you, and this is unique to you, is you are both a visionary and someone who's process oriented and able to execute. And I don't normally find that. I normally find that you usually have a visionary and then you have someone who is like the typical COO who executes. Yet I feel like your brain is able to do both. Is that an accurate assessment of who you are, or what are your thoughts on that?
Well, thanks for saying that. I mean, I have been very lucky to surround myself with an incredible team that probably makes me look better in that arena than I actually am. And I think when you're an entrepreneur, you do have to roll up your sleeves and you do have to do all the things that perhaps aren't as sexy and cool. I mean, what you can't see here is I'm surrounded by paperwork, submitting to Medicaid, state Medicaid programs to get our providers licensed and all that. We have an incredible team and, we all have to roll up our sleeves to improve access to care. That's what it takes. And I've been very lucky to be part of this team that has committed to this vision and mission. But I think you have to be a doer and not just someone who talks about it too.
And last question, before we tell our listeners about where they can find SimpliFed and more about you, I wanted to ask fundraising. I noticed that you have raised a couple of rounds, and I know statistically 2.3% of women are successful at raising, and I'm not sure if you raised venture or angel, I don't know. And women of color, it's even worse. It's like something like 0.35%. What do you think you did that was effective that our listeners who might be getting ready to pitch could incorporate?
Well, I think it's really important to be transparent about what it took, and then I'll talk about some of the systemic issues there. So raised a pre-seed round, mostly angels, and then raised a $6 million seed round, mostly from venture, have incredible investors, feel so lucky to be able to partner with them, learn from them, and just for their support of women's health. What that took, though, is I met with 140 unique venture capital firms. I entered due diligence with about 40 of them. And the reason is because I used DocSend to share decks in our data room. So I could track all this. And then ultimately 6 entered our funding round. So just to say that out loud, it wasn't just like 141 conversations. To get to due diligence, you had to have multiple conversations. And I had 40 folks that I entered due diligence with. And then to go from due diligence to them investing was many, many, many conversations, presenting at the investment committee meeting. So it just tons and tons of conversations. And it's hugely important that you stay focused because it's really easy to get told no 10 times and then you give up. And so I do like to share that. Now, all right, now let's talk about it though. I'm very lucky that I'm part of some amazing networks from across my career. And unfortunately, if you don't have access to networks, it is very hard to get in with investors. And that's where one of the disparities come from. So right off the bat, and I've been very lucky and I worked hard to get in those networks. And if you're not in with those networks, that's a huge place that folks get left behind. Secondly, where I think that a lot of women get left behind is by the time you have enough experience, expertise, confidence, and just enough passion in an arena that you're willing to dedicate to something, you are at a time in your life where you're often having kids. The life of an entrepreneur, having kids, and again, as a 39-week pregnant person, I can speak to this, is hard when you're a parent, and especially when you're pregnant and postpartum and navigating all that. And so this is why I think we need to really take a step back and think about what are the support infrastructure in place. What you don't see behind me is, my parents are here right now. My kids, thankfully, we can afford as a family daycare, but I have access to tremendous support that many folks do not have access to. And so if we actually want to improve the amount of women in entrepreneurship, we need to tackle some of these larger infrastructure issues, social infrastructure issues in the US. And that is my strong hypothesis on why we don't see women, lack of access to networks, and more support in and around founding companies for folks that are parents.
Do you think that it mattered that you had already exited once?
I think track record is important as well, for sure. And that helps build credibility. And again, it's all part of being in network. So, and that's why when I'm speaking with folks that are first interested in becoming an entrepreneur, I say, be part of another company first and see what it's like, build your network there, build your track record there, because it's a great way to build your credibility, but also get a front row seat to being in a company. And actually, before I did smart scheduling, my boss's boss at Boston Scientific invited me to be the first employee at a company called Biomedical, which ultimately exited as well, a very successful exit to Abbott. And long story short, that experience gave me that front row, an educational experience to see what entrepreneurship was like, build my network, build my track record. I did that during grad school, kind of as a nights and weekends thing. And I was forever grateful for someone being that mentor and guide to me.
That is incredible. And I want to just thank you so much for coming on the show. I would love it if you could tell our listeners where they can find out more about SimpliFed. And I would like to check in with you a year from now and see how you've grown.
Oh, well, I would love that. And I encourage folks to come check out our website, SimpliFed.com, SimpliFed.com. You can text us at 888-458-1364, and we'll start getting access to care, or fill out a secure form on our website. Come check out our website. If you have a friend or a family member that needs access to support, share our website. Also follow us on Instagram at SimpliFedBaby, and we would be honored to serve you and support you in your baby feeding journey.
Thank you so much for sharing your vision and for showing up so authentically today.
Oh, thanks so much for having me. It's been a true pleasure.
You've been listening to She Ventures. Like what you heard? You can find us wherever you get your podcasts. Be sure to subscribe and sign up for our newsletter so you never miss a show.